My hello and welcome to all of you once again to DAM Studio. I'm Dr. Sachin, Psychiatry faculty, and today I'm here with another NEET PG ranker, Dr. Niyor Baruah from Vadodara. He has secured a rank of 72 in All India NEET PG 2024. Congratulations, Niyor. Heartiest congratulations and very much welcome to the DAM Studio.
Thank you so much, Sachin sir. Thank you.
Niyor, how are you feeling about it now?
I'm feeling really happy. It's not still sunk in, so I'm overwhelmed, but slowly it's sinking in. So I'm really, really happy
Tell us,
about the result.
tell us about yourself, Niyor.
So I'm Niyor Baruah. I have completed my internship this year from Baroda Medical College. I'm actually originally from Baroda. I've been brought up over here. And yes, I've secured an All India rank of 72 this year in NEET PG, and this was my first attempt.
Okay, Niyor. Tell me actually, genuinely, when did you start preparing for NEET PG?
I started seriously preparing for NEET PG in third year. In third year, I actually joined DAMS. I had joined the live session, but during the beginning of the third year, we still had COVID. So we had online classes at that time, and then I transitioned to live classes. And throughout my MBBS after starting from third year, I've been a part of the DAMS Foundation program. In internship, I took the TND program and I was consistent throughout with it, and it really benefited me. It gave me a schedule to follow throughout the internship so that I don't get distracted because of the duties. And once the internship got over, and also during the internship, I had also enrolled for the different CBTs. So right from the CBT for INICET and also the various CBTs that the DAMS had organized for NEET, I had participated in them, and coincidentally, in one of the CBTs, my All India rank also happened to be 72. So I just was going through some of my screenshots, and I just realized that one of my ranks in one of the DAMS CBTs also happened to be 72, which is my NEET rank. So this has been my preparation so far, and throughout I have been using DAMS, whether it be after the postponement and throughout, like to keep in track with my schedule through the mini TNDs and the DVT sessions. So this has been my journey throughout, where DAMS has been the main skeleton of my journey. Yes.
Okay, Niyor. You mentioned you joined in third MBBS. What motivated you to start early?
There were a couple of factors which motivated me to start early. First of all, I had been listening to a lot of seniors. I had seen a lot of good ranks come from our college as well. So that sensitized me that there is an exam called NEET PG, which I will have to crack. It is not an easy exam, but it is a doable exam because I had my college seniors who I had seen studying in the library in front of me, passing with flying colors. So that was one motivation. And of course, within peers also, there was a lot of discussion about starting preparation for NEET PG. So these were the main reasons, but mostly it was looking up to my seniors and believing that since these people have done it, they have followed this path. So if I follow them, it will be possible for me as well.
How important, according to you, is starting early?
Starting early is extremely, extremely important because I believe from my experience, starting early allows you to strengthen your concepts a lot. And looking at the kind of question paper that came right this year in NEET PG, I feel the paper is turning more towards testing your basic concepts more than anything else. So if you start early, you have more time in hand to strengthen your concepts, to chisel the imperfections that you have along the way, and to fine-tune your preparation to get the seat of your choice or the branch or the college of your choice. So I feel preparing early, starting your preparation early is very crucial.
So when you started preparing in your third year, you attended the classes on DAMS online platform. What was your target? Could you finish all 19 subjects making notes in third year?
In third year, the initial few classes were online, which I attended and made notes for. And after the COVID wave had subsided, we started with offline lectures. So I stuck to the schedule which DAMS had come up with. So according to that schedule, we had most of our final subjects and third year subjects in my third year. So I covered third year and final year subjects in my third year. And in final year, some of my first and second year subjects were left. So those few which had not been covered in my third year, I covered them up in my final year, the starting portion of final year. So by the end of final year, I was ready with most of my notes, and I'd gone through most of my notes at least once or twice, minimum once or twice.
Okay. So at the beginning of internship, you did not have to attend the full classes again. So because you had already prepared the notes. Did these notes help you in your university exam as well?
Definitely, definitely. The notes were helpful not only for NEET PG, they were my main source for revising in NEET PG, but also I used them for my professional exams during MBBS, for my your credit exams, as well as for practical exams. For subjects like medicine and surgical practicals, I would also refer to these notes for those. So they were helpful throughout, whether it be a professional exams, practicals, or NEET PG. So the DAMS notes were very helpful.
Okay. So tell us, how did you follow during internship?
Internship, I started slow. It was a little difficult for me to gather pace. So initially, I was just going along with my reading, my revision cycles, and I was also attending the TND. The TND really helped because it gave me a schedule, because we have a moderate to heavy duty in my hospital. So having the schedule of TND and knowing which subject I have to cover within the next week so that I can appear for a test the next weekend gave me a schedule which I could follow, and it somehow allowed me to cover a lot of syllabus without necessarily making a schedule of my own or having to beat myself up for not, following up my schedule or not, which could have been the case otherwise, because we had hectic duties as well. So during internship, my main goal was to cover at least one or two revisions. And I had made a schedule according to the schedule that was given by the DAMS TND. So that was my main backbone. And I would say I was not very happy with the way I had followed up with revising during internship, but luckily we got an extension, we got postponement, so I was able to refine my preparation and my strategy after my internship got over. So after my internship got over, I was able to fine tune my preparations.
Okay. Okay. So when you attended TND at DAMS, how was the discussions that you attended?
The discussions were very fruitful. I love the fact that in the TND, you have 75 questions of a subject, if it's a small subject, or of a topic, if it's a big subject, which covers pretty much the length and the breadth of that particular topic, which is a great feat because the subjects that we study are so vast. But here you have 75 questions, which technically more or less cover the entire length and the breadth of the subject, and they're very concept-based, which is what I realized. They're very clinically oriented, and each question is testing a very core concept. And a lot of the questions, most of the questions, if not all, this time, which the paper which I attempted were also similar, where they were testing more of concepts, and it was less based on PYQs or facts as per se. So there were topics which were repeated, core concepts which were tested, and it was very similar to the kind of questions which I was used to solving in the TND. And I really liked the way first we had to sit for the exam and we had to attempt all 75 questions at one go. And then we had to evaluate how well we had done, and then understand where we had made flaws and rectify them. So that was a very fruitful experience. In fact, for some subjects like anesthesia, even for the last minute revision, instead of reading the main notes, I just flipped through the TND because it covered covered the subject quite comprehensively along with the DVT. So TND was very, very fruitful for me.
You mentioned about DVT. How was your experience about DVT?
DVT was definitely, as a lot of the faculty at DAMS-eMedicoz, was definitely a game changer for me. I attended it live through VSAT from our center in December, Jan, whenever it happened. And after that, I have kept revising and re-revising it. And since I had, as I mentioned, I had joined early, I had been able to revise the notes adequate number of times before. But as the exam draws nearer, your revision cycles have to get smaller and smaller so that you can fit in more number of revisions. And that was made possible by a concise and a very high-yielding source, which was the DVT. Uh, it concised a lot of important and seemingly complex concepts into flowcharts and diagrams and one-liners, so that when I was going through those flowcharts, at the back of my mind, I was also revising the notes of that particular subject which I had done, which I didn't have the time to go back to at that point of time, but it was an indirect way of recalling them. And it was my go-to source of revision in the last 7 days of the last lap of revision which I had, and it was very, very, very beneficial for me.
You also mentioned about CBT that you got rank 72 in one of the CBT. How many CBTs have you attempted?
With the postponement, I have lost track of it, but I think I have attempted at least 4 to 5 minimum, 4 to 5. I can't recall the exact number of CBTs.
Okay.
The first CBT was the INICET CBT, and then I think I gave 3 more. And then after the postponement, I think I attempted 1 or 2 more after that. So that was those were the CBTs that I attempted. Yes.
How was your experience with DAMS-CBT?
DAMS-CBT was again a very, very helpful experience. First, initially I wasn't so serious about it when it was right. Some of the CBTs were right in between the internship, so I was not so serious about it. However, subconsciously I got used to the entire experience of going a little far, because some of our CBT centers were also slightly far from the place. So going a little far, sitting together with a room full of students. There are students to the left, students to your right. So you might not have this experience every time you give a GT at the comfort of your home or your hostel. So that was a very important learning. Towards the end, I became more serious, and what really helped me in hindsight in the final exam was that the CBTs were not necessarily very easy. A lot of the questions would be moderate to tough. Some of the questions would be also some questions would be unheard of. So when I had gone through those CBTs and I had gone through those, the experience of attempting questions which I was not familiar with, that gave me confidence and also allowed me to stay level-headed throughout my final NEET PG exams, which also had a lot of questions and topics which were slightly tricky or which were not typically expected in NEET PG. So in addition to the experience and the questions, which of course you get a set of 200 questions, 200 new concepts that you're tested on in each CBT. But in addition to that, the entire experience of the emotional experience, the mechanical experience of, tapping on the keyboard, the emotional experience of maybe you come across a set which is difficult. So all of that helped me to control all of that and, make sure that I am level-headed throughout the final exam. So that is how the CBT helped me.
Okay, apart from CBT, DVT and face-to-face classes, is there any other thing on the DAMS-eMedicoz app that you used?
I used some other features as well. So initially during third year and fourth final year, I was also solving the DQB, which I found very helpful. After that, during my UG days, I would also tune into the integrated lectures, which I found very interesting and very exciting at that time, because that was the first time I was starting to integrate different subjects together. Say, suppose medicine with radiology, or pathology with medicine. So that was very, very helpful because in this exam also we saw that there were lots of integrated questions. So I had watched a lot of those integrated sessions that DAMS used to be uploading during the UG days. Then I also attempted I had made it a ritual, made a part of my routine, the daily quiz which was there. So sometimes when I would be, some days, you are tired or you're not motivated, but at least you do those 5 questions, you learn 5 new concepts. So that was a part of my daily routine, the daily quiz. And towards the end, I was also giving the mini TNDs and the DVT-based tests that DAMS had come up with. So these were the other different resources that I used from DAMS, and they were quite helpful.
I have taken many interviews and students were saying, just like you said, this NEET PG paper was a little different from the routine style of NEET PG. Considering this paper, if somebody wants to prepare for the next exam from your batch who has finished internship but now planning to sit 1 year post internship, 2018 batch itself, what is your advice to them how they should invest the next 1 year?
My advice for them would be first to invest in understanding core concepts. All subjects are going to have core concepts. Try to understand the core concepts first. It is very tempting to fall for facts and random information here and there. All that will get taken care of later during as you near the exam. But if you have 1 year from now, I would suggest invest heavily on understanding core concepts and going through your main notes and understanding them. Secondly, I would say be very rigorous with attempting questions and having an MCQ practice. This is something that something that I neglected during internship, but I felt it really helped in the last few months when I caught up with it. Do at least 100 questions every day, regardless of how well you've prepared, regardless of how many corrects you're getting, how many wrongs you're getting. Do GTs regularly and be serious with them, review them, analyze them, understand where you're making mistakes, and lastly but not last but not the least, spend time on analyzing where you are. If you're giving GTs, if you're done with a certain amount of revisions, I would spend at least half a day or 1 day analyzing what I have covered, where I am, how I'm performing in the GTs, how well I'm scoring in my custom modules, and fine tune your preparation. Because during internship, I had got stuck at a certain score in the GTs, and I realized with hindsight that I was just doing revisions one after the other, and doing GT after GT after without understanding where I was making mistakes. So sit with your progress so far, understand where your deficiencies are, and fine tune your preparation accordingly. So three things that I would like to recapitulate would be focus on and invest in core concepts. Second would be attempt questions, whether it be custom modules, GTs, and analyze them. And third would be have a strategy, analyze, sit with yourself, understand where you are in your journey, and analyze and fine tune your preparation, and that will really help you push forward in the competition.
Lastly, what is your advice to any undergraduate from your college junior who is just starting the preparation now from third year? Because I'll be forwarding your video as you mentioned that you got motivated from your seniors. So Baroda Medical College, as far as I know, has a legacy of producing top ranks. And there are many students of your juniors who are looking forward to hear from you. What is your advice to your third MBBS junior right now?
My advice to the third MBBS juniors would be start early, have your main concepts very clear, invest in reading standard books and standard sources, make it a point to regularly go to the wards, engage with the residents over there, engage with the professors when you come across them, engage with the patients. Try to apply whatever you're learning, whether it be in your lectures, college lectures, whether it be while reading your standard books, or whether it be in your DAMS classes. Try to apply those things in the patients that you see. That will go a long way, especially looking at how the paper style is changing. I feel these are the key takeaways that a student of third year should be key takeaways for a student of third year.
Finally, before we close, you have achieved a massive success in this exam. Any person you want to thank towards this in this journey, in your family or friends?
I believe even though it's only my name written against this rank, I believe this has been it's been a mammoth task. There have been a lot of people involved. I would like to thank my parents and my family for being a constant pillar of support. I would like to thank my friends at college who have been with me throughout the journey, who have studied with me. We have done group discussions. We've attempted quizzes and whatnot. I would like to thank all of them. I'd like to thank my seniors who've been a constant source of motivation and guidance, and also my juniors who've been with me for different quizzes, discussions, and so far and so forth. And last but not the least, and the biggest token of gratitude would be to the entire DAMS family, because every single faculty, every single person has played such an instrumental role in getting me here where I am. Because throughout DAMS notes has been my sole source of revision. And I would like to thank the entire DAMS fraternity for being with us throughout, whether it be postponement, whether it be COVID, and whether it be the motivational videos. It was really helpful, and this feat wouldn't have been possible without you all. Thank you so much.
Thank you so much, Niyor, and it was a great pleasure talking to you. You explained everything elaboratively, and I'm sure this is going to help the future aspirants. Thank you so much. It was pleasure having with you. I invite you to be a part of the DAMS Career Counseling event in Delhi, and we'll look forward to see you there. Thank you. Bye-bye.